Welcome to the MS&Me Radio Network. The broadcast shows are for informational and entertainment purposes only. They are not designed to provide listeners with specific personal, medical, or counseling advice. Individuals with a medical issue should always consult their healthcare provider. MS&Me is not responsible for content of individual shows. The views expressed by show hosts or their guests are their own. Enjoy the show. In the Know with MS&Me Media, we're coming to you live from ACTRIMS 2018. Today we have been treated to wonderful young investigators, emerging concepts in the treatment of multiple sclerosis. Stay tuned to all of our social media and our website, www.msmemedia.com, for our coverage, and later we'll post it all to our YouTube channel for your review. We will bring all of the information so you're in the know. We're here at the second day of ACTRIMS in the Know with MS&Me Media. Today we have with us Dr. Ben Siegel. And Dr. Siegel, could you give us a brief explanation for patients who are living with MS? What is ACTRIMS?
So ACTRIMS is an academic organization composed of professors, both researchers and clinicians from the U.S. and Canada. And our mission is to increase education about MS and also to promote research towards better treatments and to increase our understanding of the disease and ultimately manage patients more successfully.
And this morning we were treated to a session where we learned more about the blood-brain barrier and some new news about that. Could you share with the patients kind of a synopsis of what we learned this morning?
Sure. Well, one of the earliest events in the formation of an MS lesion or plaque is breakdown of the blood-brain barrier. The vessels that feed the brain and spinal cord and the optic nerve become leaky, and that allows inflammatory cells to enter the tissue and cause damage. And some of the drugs we use now are designed to block immune cells from crossing the blood-brain barrier. For example, natalizumab, also known as Tysabri, prevents white blood cells from sticking to the lining of blood vessels, which is an early step before they pass across the blood vessel into the tissue. So today we had 4 excellent talks, which are about cutting-edge research, using animal models as well as imaging of patients during lesion formation to better understand on a molecular level and a cellular level exactly how the blood-brain barrier breaks down and what type of interactions occur between the white blood cells and the vessel lining cells that permit their entry. And this could lead to a new generation of treatments that block the inflammation from occurring in the first place, stop relapses, and maybe have less side effects because they may be more selective for the type of immune cells that they're targeting.
We've had so many exciting sessions already, and then of course yesterday we talked about some of the new investigators as well. Now this evening we have a very good program. This is really cutting edge news, and we're keeping it under wraps until after 4 p.m., but we will let you know what we learned from that session. But can you give them a preview? We promise not to let the cat out of the bag until this session this evening, but can you explain to us some of that cutting edge information we're going to get this evening in the session?
So there are 4 talks that were selected from late-breaking abstracts. This is the newest research that is currently being revealed in people's laboratories, hot off the burner. And a lot of the talks have to do with how could we instigate repair. in MS. Once damage is done, we need to try to restore lost functions. And how can we do that? How can we stimulate reconstitution of the damaged myelin sheath? So there are a couple of talks that are about that. There's another talk that is about how we could increase safety by decreasing side effects with drugs that we currently use, or a drug that we currently use. So we're very excited about this cutting-edge research that's going to be presented.
Well, we really thank you, Dr. Siegel, for taking time out of our very busy schedule here at ACTRIMS to speak with the patients. And we will keep you in the know with MS&Me Media, here with some additional information on the first day of ACTRIMS 2018, the Young Investigator session. We had some wonderful information shared from that session. Can you elaborate a little bit on that, Dr. Siegel?
It would be my pleasure. One of the major missions of ACTRIMS is to encourage young researchers to enter the field and do excellent research, the next generation of researchers as well as clinicians. And so this year we received a record number of abstracts from young people throughout the US and Canada, which is focused on multiple sclerosis. And we had experts review those abstracts and selected 7 for oral presentations. And these presentations were very superior, outstanding platforms. We had some of these young scientists talking about the types of inflammatory cells that cause damage in multiple sclerosis and what are the factors they produce that perpetuate the injury. The implication is that we could develop new drugs that specifically neutralize those damaging molecules. We also had a talk on the effect of puberty on susceptibility to multiple sclerosis, and looking at genes which control or regulate puberty and how those relate to susceptibility to MS. Because as you know, MS is generally a disease of adults. It does affect children, but it's much more common in adults, and some of that has to do with the changes which occur during puberty. We had some interesting talks on repair pathways in the central nervous system that may be stimulated through new therapeutic interventions. So it was a diverse group of talks, but the quality was very high, and we're very proud of those young investigators. Something else?
Yeah, and can you let them know what will we be seeing in the last day of ACTRIMS on the third session? I know that normally everyone thinks, oh, that's a wrap-up day. But this year, we're going to learn some really good information on the third day as well.
Mm-hmm. So today, a lot of the talks are about the immune cells that cause the damage. But the last day, we're going to talk more about the cells which are already in the nervous system and how they respond to the inflammation, both in terms of how they're damaged and also how they may begin to initiate repair. So one session is on a cell called an astrocyte, which is a support cell in the central nervous system that is activated by the immune cells. And we know it's very important in the evolution of MS, but there haven't been as many studies on it. And so we have one session just devoted to the role of that cell type in the disease. We also have a whole block of talks on the cells that produce the myelin sheath. And we'll be discussing how the myelin sheath is damaged, but also are there strategies that we could develop to stimulate myelin-forming cells to mature and synthesize new myelin sheaths. And throughout this forum, we've been trying to combine basic scientist perspectives with clinical perspectives. So in all of those talks, particularly the one on the myelin-forming cells, there's going to be scientists talking about the basics, but that's going to transition all the way up to a recent clinical trial of a drug that shows promise for stimulating new myelin production.
That is very exciting news for patients living with MS. So we really appreciate you taking your time to share with the patients what we're learning here at the forum. Thank you, Dr. Siegel.
My pleasure.
We are here at ACTRIMS 2018 in with the morning press session. And may you introduce yourself, please, for the patients at home.
Yes, I'm Jack Cantel. I'm a neurologist from Montreal at the Montreal Neurologic Institute, and I am currently the president of ACTRIMS.
Wonderful.
I'm Benjamin Segal. I'm a neurologist at the University of Michigan. I'm director of the Multiple Sclerosis Center there, and I am the program chair of ACTRIMS Forum 2018.
And Dr. Intel, can you please give us your impressions so far of these sessions, days 1, 2, and what we are looking forward to day 3 at ACTRIMS 2018?
So my impression is that our original goal of bringing together people who covered a spectrum of MS, from treating people with MS to understanding the basic underlying abnormalities, I think has been very successful by having everybody in the same room, hearing the same presentations, allowing them to ask questions. I think we're trying to bring all these communities together, and I think that's been a success, and I anticipate it will be successful in final sessions as well.
Yes, I agree. What do you feel is the most we'll cut that out. groundbreaking news that we have out of the research presented during the sessions?
So I'm hesitant to answer that because there's just too many things, and in fact, multiple sclerosis is too complex to think that we'll answer it with one breakthrough. We've gone all the way from people considering what may predispose you to the disease, why it behaves in a certain way, why we can treat some aspects, and that I think the major issue is by everyone pointing out what they've observed, it's funneling the important questions together. So I think, in fact, the notion of asking about single breakthroughs, I think we want to avoid silos. I think that's the intent of the meeting.
Yes, I think that is what I have gleaned from it as well. Do you feel that we are within a few years of actually having remyelination therapies coming up for trial?
So we have remyelination therapies in trials now. That the issue of remyelination, again, like many issues in MS, are more complex once you start digging into it. For example, if you take a little mouse and give it a toxin, you get rid of the myelin, and then it actually starts to produce its myelin. You can start immediately testing your agent. That's not the same thing as presumably in MS, where the myelin has been damaged maybe for a long time. It's occurring in a background where there may be scars that we have to overcome. We have to know whether the nerve fibers are capable of accepting the myelin. So yes, we've started, and I think it's very positive that the ideas got translated into the clinic so quickly. We have to know how to measure it, and that continues to be a challenge.
Now, with the recent discovery that the brain also has a lymphatic system, do you think that that will play a key role in future treatments for multiple sclerosis?
So the notion that the brain had a lymphatics can actually be traced back for a number of years. And again, it just illustrates how as we get new tools, we can see these things more clearly and understand how they work. And probably this relates to the notion of how events going on in the brain signal back to the rest of the body, to the immune system. And so can we take advantage of manipulating that system? remember, some of the signals may be positive. They may be telling the immune system, come in and do something good, not always something bad, so we better remember that.
And in your impression, from all of the research you have seen recently, do you feel, just as comes out of many scientists in the UK, that we are moving toward a single source trigger, such as a virus, for triggering the genes for multiple sclerosis? Or do you feel that we will discover many triggers, just as we have in theory now?
So I think we've identified that there are many triggers. It is, when one says, is this a straightforward genetic disease? The first thing you do is look at identical twins. And identical twins, you can have those that one affected, one unaffected. One can have a very benign course, one can have a very severe course, so that it gives us the opportunity to start working on all those factors. If you listen to what goes on from the basic scientists, and they talk about inducing inflammation in the brain, this animal model called EAE, you have to listen carefully, because if you were to catch 1,000 mice out in the field and inject them the way the scientists do, you'd be lucky if one mouse got the disease. So you realize how many different variants there are, and then you hear this theme. Let's understand the genetics. Let's understand how things are acting on the person who is in some way is susceptible to the disease. So they're probably all important. And one hopes that if we pick away at individual ones, it'll have an overall effect. Hopefully we don't have to take care of everything.
Yes. And there's a debate in the patient community right now. It's highly debated in social media that the body can heal itself. We hear from so many doctors, well, your body can heal itself. So if you change your diet and your nutrition, then you do not need to go on a DMT. Can you speak to your very vast knowledge on that subject?
So it is hard to answer precisely, because it's tempting to compare what was the disease like before we used the current anti-inflammatory therapies, but because we didn't have the tools, we don't have the documentation from the MRIs, diagnoses were made much later, but it is certainly the impression, and a strong one, that the disease is now behaved in a different way with the therapies compared to the pre-DMT era, where people did use all sorts of diets and therapies. There is a remarkable book that was put out by the MS Society, I think it was the International MS Society some years ago, about therapies in MS. They tried to make a tabulation of therapies that were used in the 1930s and 1940s. And what's remarkable there, I don't know how they got the list, but they have nutrition, and they have vascular, and they have allergy, and they have a whole long list. And when you look at it, they list the number of people treated, 100, number who got better, 50. We haven't matched that yet.
And Dr. Ontel went ahead and clarified off camera that the reason we have not been able to match that early study is because with that early study there were no controls. So it was a very small study and no controls within the study. So we have not been able to match those results for 50 out of 100 making improvements. So that has not been matched in recent studies.
So how careful we have to be, and it's not necessary that these things are exclusive, so that I think we would certainly support people doing the healthiest possible things and then add on to it. Let's take advantage of everything.
Everything, all that we have in our arsenal.
That's right, but again, just like with our therapies, where we pay an enormous attention to, is there a downside to it? Yeah. I think we have to do the same thing when people are taking natural products or any other approach. Is there a downside as well as an upside?
Yeah, risk benefit
Exactly.
and everything. Okay. Well, thank you so much for sharing that information
My
with
pleasure.
us. And I am looking forward to today's session.
Thank you. Thank you for coming.
Oh, my pleasure.
And we're very important for us is that the MS patient community understands what we're trying to do and that we're all on the same side.
Absolutely. We've called this conference for the MS patients, as we've been sharing, In the Know with MS&Me, and we want to bring it to them. And what we are planning on doing next is on Fridays on our radio network. It's a global radio network. We are opening up a whole day where our regular hosts from around the world take that day off from their shows, and we do all research radio. So it'll be research and clinical. And In the Know with MS&Me Media, we are here at ACTRIMS 2018 with Dr. Jeffrey Cohen of the Cleveland Clinic. Dr. Cohen, can you please introduce yourself in the microphone for the patients?
Well, good morning. Thank you for having me. So I'm Jeffrey Cohen. I'm a neurologist at the Cleveland Clinic's Mellon Center for MS treatment and research. At that center, I serve as the director of the experimental therapeutics program, where our goal is to develop and assess new therapies for MS. So the ACTRIMS meeting at which we're attending, this year's program was developed to try to illustrate new targets for therapy in multiple sclerosis. We now have 15 approved medications. They've been very helpful in controlling the disease, but all of them have some drawbacks. They either work incompletely in some people or have some safety issues or side effects. So the goal of this year's meeting was to explore some new targets for therapeutic approaches in multiple sclerosis. We've been exploring aspects of the immune system that may be incompletely controlled by our current medications, and then to also explore some new avenues for therapy. The current therapies are very effective in controlling relapses, attacks, and activity on the MRI scan. But for example, they're not very effective in slowing or stopping the very gradual worsening that happens in some people, so-called progression. The sessions have explored some potential targets to control that aspect of the disease. And then the hope is that this will give people some new ideas. They'll start to develop some new therapies.
Thank you so much for that.
Confusing to people is when should they call their doctor? What is an attack? How can they have symptoms when the MRI doesn't look different? What I tell my patients is that as we're meeting over time, we're trying to get a sense of whether their disease is stable or is active, and we do that in several ways. One is we ask the patient their symptoms, whether they feel better or worse. We perform a neurologic examination to see if there are new or worsening findings on the examination. And periodically we do an MRI scan looking for either new spots, new lesions, or activity. And we detect that by the gadolinium injection that you may have had during some of your MRIs. None of those is the end all. None of them trump the other ones. They're all ways of triangulating on how the disease is doing. We know that none of them completely captures what's going on. One point of confusion is distinguishing a relapse, an attack, or an exacerbation. Those are all words for the same thing, from just symptoms that may fluctuate. So typically an attack is a very clear-cut event where either brand new symptoms develop over several days, or sometimes old symptoms may clearly worsen. They persist for typically a week or two, and then start to recover on their own often. Either back to normal or with some residual. In retrospect, a relapse is typically very clear-cut. Now, what can be difficult to distinguish is the early stages of a relapse where symptoms are just starting to develop from the fluctuations in symptoms, pre-existing symptoms that many people with MS experience. So sometimes people had a previous episode that led to weakness. They may find that on some days their weakness is a little bit worse. Sometimes that can just be from being tired. It can sometimes be the indications of that an infection is brewing, often a urinary tract infection. It can be the weather. Or sometimes it just happens for reasons which we don't understand. What we tell our patients is that if they are concerned that something is changing, that would be a good time to contact your doctor's office and let them help sort out whether it is something of concern. On the other hand, if you don't need to worry about symptoms that may come and go a little bit one day and then they're gone, that's probably just these fluctuations.
Can my older lesions become active again?
Yes, so MS can be active in several ways. One is that a new lesion, a new spot can develop in an area of the brain or the spinal cord that wasn't previously involved. Sometimes an old spot that has recovered and has left a scar behind can become active again, so old symptoms can reappear. And then an area that we don't fully understand is that there's probably another process in MS, which is gradual degeneration, gradual deterioration of the nervous tissue. We think that underlies in large part the gradual worsening that we call progression. In some way, that's a different process because it doesn't manifest on the MRI the same way. Frequently, people may deteriorate and the MRI doesn't change. And it also doesn't seem to respond to our disease therapies as effectively. That's why there's such an impetus to develop new approaches to treating MS.
Well, thank you so much for clearing that up for the patients.
Yeah.
And have a wonderful session today.
Thank you.
Thank you. Hello, with MS&Me Media. We just attended our final session here at ACTRIMS 2018 in San Diego, California. We had an exciting 3 days of therapeutic targets in MS. The America's Committee for the Treatment and Research in MS had an amazing forum this year. From the young investigators and their science to the poster sessions and the senior researchers with their symposia. It was some exciting sessions, and we'll bring all of that to you on our social media. We were able to attend a press session this morning and interview the president of ACTRIMS, Dr. Jack Antel from McGill University, and then we were able to speak with the president-elect of ACTRIMS, Dr. Jeffrey Cohen from Cleveland Clinic, and then we once again spoke with the programs chair here at ACTRIMS, Dr. Ben Siegel with the University of Michigan. We will bring all of those interviews, our synopsis of ACTRIMS this year, and of course all of the key points that we'll highlight and give to you on our website, www.msmemedia.com, as well as on Twitter, and all of the video will be available to you on our YouTube channel, MS&Me Radio and Media, and look for everything to be made available to you in all of our forums, Instagram, everywhere else that you see MS&Me Media. Now, this coming Sunday, we will have a breakdown show of everything that we learned here at ACTRIMS 2018 on MS&Me Interviews, 3 p.m. Eastern Standard Time, this Sunday on the MS&Me Radio Network. You can listen to that 24 hours a day, 7 days a week, MS Radio at msme.airtime.pro. Have a great weekend, everyone.